You know how sometimes you hear a phrase so much, it kind of loses all its meaning.
Yeah, totally.
Lately, I feel like that's been happening with how we talk about addiction.
Mm-hmm.
It's like, it's either just say no
Right.
or like the whole tough love approach.
Yeah.
And I'm like, but what about everything in between those two
Yeah.
extremes? What about helping people where they're at right now, even if quitting altogether isn't on the table yet?
Right.
That's where I feel like this idea of harm reduction comes in.
Absolutely.
And the more I've been reading about it,
Yeah.
the more I'm like, okay, there's something here.
It's fascinating. It
Yeah.
really is a different way of thinking about things because instead of saying, look, it's abstinence or nothing, it's more like, okay, how do we reduce the negative impacts of, these risky behaviors right now immediately?
Totally.
Like we're acknowledging that people are using drugs and sometimes, honestly, just reducing the harm is a win.
It's about meeting people where they are.
Right,
Like,
exactly.
I noticed that phrase comes up a lot in the stuff we've been looking at.
Yeah, and I think it's important. Harm reduction is about saying any positive change is a good thing. It doesn't have to be this complete, all or nothing thing.
Yeah.
It's about progress. Like, think about needle exchange programs.
Right.
That's a great example. People are going to use anyway, but if we can provide clean needles, we can at least reduce the spread of HIV and Hep C.
Makes sense.
Or naloxone. Right.
Yeah, yeah.
That medication that reverses opioid overdoses.
It's saving lives every day.
It is. It's harm reduction in action.
It's such a practical approach.
Totally.
But I'm curious about the specifics. I mean, we've talked about needle exchanges, but what other strategies are out there?
Oh, there's a bunch.
Okay.
One that's getting a lot of attention is safe spaces for drug use,
Okay.
which, again, might sound a little strange at first,
Right?
but the idea is that people can use under medical supervision,
Oh, I see.
which can help prevent fatal overdoses.
So it's about reducing the risk in those really high-risk moments.
Exactly. And then you have things like drug checking, where people can literally have their drugs tested
Wow.
to see how potent they are, if there are any contaminants in there,
That's crowd.
which can be life-saving, honestly.
Yeah, I could see that.
And then you even see things like designated driver programs.
Okay.
Yeah. Which is interesting because it's like we often associate harm reduction with drugs, but it can be applied to alcohol too.
Oh, totally, yeah.
It's about reducing those immediate risks wherever we can.
So it's like you're creating a safety net
Yes.
while someone is like, maybe working towards those bigger changes.
And the exciting thing is the data supports it.
Really?
Yeah, there's more and more research coming out all the time, and it's showing that harm reduction leads to some really positive outcomes.
Like what?
Like, people who engage in harm reduction programs, they're more likely to access health services in general.
That makes sense.
Right. And we see a decrease in HIV and Hep C transmission.
Wow.
And this is huge. There are even fewer overdose deaths.
That's incredible. But I know there's pushback too, right?
Oh, for sure.
Some people hear harm reduction and they think it's encouraging drug use.
Right. Right. Which makes sense on the surface, I guess.
Yeah.
But here's the thing, and the research actually backs this up. Harm reduction doesn't lead to more people using drugs.
Interesting. So it's not about enabling, but more about like empowering people.
Yeah, I like that way of putting it.
Because if you think about it, if someone feels judged, they're probably less likely to reach out for help.
Exactly.
But if there's this space where they feel supported,
Right.
even if they're not ready to quit, maybe they're more open to it down the line.
Yeah, and that's what we're seeing. By offering support without judgment, you build trust, and that trust can be a bridge to treatment.
That makes a lot of sense.
And it's funny because sometimes the things that sound the most counterintuitive, like we're going to provide a safe space for people to use drugs, those are the things that are actually having the biggest impact.
It's about meeting people where they are, which I guess can be a little messy sometimes.
Life is messy.
That's true. So one thing I've been curious about is those safer consumption sites.
Yeah.
What are they exactly, and what does the research say about them?
So basically, there are facilities sometimes called overdose prevention centers where people can use drugs, but it's in a controlled environment.
Okay.
They've got sterile equipment to reduce the spread of diseases, and there's staff there who are trained to administer naloxone if needed.
So if something goes wrong,
Help is right there.
which can literally be the difference between life and death.
Exactly. And, this is where things can get a little controversial.
Because some people see it as, like, condoning illegal activity.
That's it. And, the source material, it addresses this head on. because it's a common criticism. People
Right.
say, you're enabling drug use. But then you look at the research. And a study in Vancouver, for example, it actually found that a safer consumption site in the city led to more people seeking treatment.
Wow. It seems counterintuitive, but it kind of makes sense if you think about it.
Right. Like if someone's in an environment that feels supportive.
Right. They might feel less afraid to ask for help.
Exactly.
Okay, so what about the argument that these programs just increase drug use overall?
Yeah. So again, the research just doesn't support that.
Huh.
Studies have shown that these safer consumption sites, they don't lead to more people using drugs, and they don't lead to more crime in the surrounding areas either.
So it's almost like there's this clash between our perception of harm reduction and what's actually happening.
Totally. And I think that's what makes it so important to look at the data,
Yeah.
because our gut reaction might be one thing, but the reality is often quite different.
It's like we can't let our assumptions get in the way of what actually works.
Exactly. And you know what else is interesting? The source material talks about this idea of creating a welcoming approach
Okay.
where people feel empowered to be active participants in their own care.
Which is interesting because it suggests that it's not just about providing services, but it's also about shifting the power dynamic.
Yes.
It's about recognizing that people know what's best for themselves.
It's not about telling people what to do. It's about giving them the tools and the support to make their own choices.
And I think that's really key, right?
Yes.
Because it acknowledges that everyone's situation is different.
Their journey is different.
Exactly. And what's also really insightful, and I like how the source material highlights this, is that drug use isn't just an individual choice.
Right.
It's often tied to so many other things like social factors, economic factors, things that are often beyond a person's control.
It's about the bigger picture.
Exactly.
Yeah.
So all of this is fascinating, and it
Yeah.
sounds great in theory, but I'm also thinking, like, what about the cost?
Yeah, that's a great question.
Because these programs, I imagine they're not cheap to run. So, I mean, is this model sustainable long term?
Yeah, and that's something that I think a lot of people are looking at, right? Because you want to make sure that something that sounds good on paper actually can be implemented in the real world.
Yeah.
And interestingly, the research suggests that harm reduction can actually save money.
Really?
Yeah, because if you think about it,
Okay.
by preventing the spread of diseases like HIV and Hep C,
Right.
you're reducing the burden on the healthcare system.
Fewer hospital visits.
Exactly. Fewer emergency room visits. And then there are the potential cost reductions within the criminal justice system, because if you have fewer people who are being incarcerated for drug offenses.
So it's a domino effect.
It is. So yeah, it's counterintuitive, but investing in harm reduction up front might lead to significant savings down the line.
So it's not just the compassionate approach, it's also potentially a very financially sound one.
It's about being smart with resources.
This is all so eye-opening. I'm sure there are people listening who are like, this is great, but where do I even start if I want to learn more or find resources in my own community?
And that's the great thing about all of this. The source material actually provides some really concrete steps that people can take.
Okay, good.
Like it talks about reaching out to a healthcare provider, talking to an addiction counselor, or even looking online, at organizations like the Harm Reduction Coalition or the North American Syringe Exchange Network.
Okay, so there are resources out there.
Lots of them.
That's great. So with all of this in mind, for people who are just learning about harm reduction, what would you say are the big takeaways?
I think the most important thing to remember is that harm reduction is not about saying, hey, drug use is okay, or we condone this. It's about reducing the negative consequences that can come from it.
Right.
It's about recognizing that everyone's journey is different.
It's about meeting people where they are.
Exactly.
And it's about understanding that addiction is complex.
Yes.
There are so many factors that play a role.
And that sometimes those factors are bigger than just one individual.
Exactly.
And I think another really important takeaway is that harm reduction is backed by evidence.
Right.
The research consistently shows that it's effective in preventing HIV and Hep C transmission. It helps prevent overdoses, and it helps connect people to treatment and support services.
It's about giving people a chance.
It is. And it reminds us that compassion, coupled with a willingness to challenge our assumptions, can lead to really innovative and impactful solutions.
It's about thinking outside the box a little bit.
It is. And sometimes those outside-the-box solutions are the ones that end up working the best.
I love that. This has been incredibly eye-opening, really. Yeah. It's a good reminder that sometimes the best way to approach a problem is with understanding rather than judgment.
I agree.
We've covered a lot, though. We should probably take a break, let everybody absorb all of this information.
Yeah, good idea.
And then when we come back, we can delve into some specific examples of harm reduction strategy.
I'd like that.
Awesome. So before we take a break, I'm really curious to dig into some more of those concrete examples
Yeah.
of harm reduction in action.
Oh, okay.
Like, what are some of the programs and initiatives that fall under this umbrella?
Well, one area where harm reduction has really taken off is in addressing the opioid epidemic.
Okay.
You've probably heard of fentanyl, right?
Yes, it's been all over the news. It sounds really scary.
Yeah, it's a serious concern because it's so much more potent than heroin, and a lot of people don't even realize they're using something that's laced with it.
Which makes the risk of overdose so much higher.
Right, exactly.
That's terrifying. So how does harm reduction address that specific issue?
So one way is through fentanyl test strips,
Okay.
which basically allow people to test their drugs for the presence of fentanyl
Yeah.
so they can make a more informed choice,
Okay.
like maybe using a smaller amount or even avoiding it altogether if they know it's in there.
It's like giving people the knowledge to potentially save their own lives.
Right, it's all about empowering people to be safe.
It's like knowledge is power in action. Are there other innovative harm reduction strategies being used for opioid use specifically?
Oh yeah, definitely. One that's pretty interesting is heroin-assisted treatment.
Okay, now that sounds kind of counterintuitive.
It does, doesn't it?
Like you're giving people heroin to combat heroin addiction.
It seems kind of backwards, I know, but just stick with me for a second.
Okay.
So basically, in some countries, people who have really severe heroin addictions and who haven't had success with other treatments, they're given pharmaceutical-grade heroin,
Okay.
but it's in a controlled setting.
So it's like a harm reduction approach within a treatment setting.
Exactly. They get a measured dose under medical supervision,
Okay.
which reduces the risk of overdose, obviously.
Right.
And it also means they don't have to turn to illegal sources to get it.
Right. Which often comes with its own set of risks and dangers.
Exactly. And this can often help them stabilize their lives enough to engage in therapy or other support services.
Wow. That's taking meeting people where they're at to a whole new level.
Right. It's about recognizing that sometimes you need to take a different approach.
And what's so fascinating to me is how harm reduction isn't just one thing.
Right.
We've gone from needle exchanges to fentanyl test strips
Yeah.
to heroin-assisted treatment.
It's a whole spectrum.
It's not a one-size-fits-all approach. It's about finding what works for each person and situation.
Exactly. And I think that's one of the things that makes harm reduction so effective. It's adaptable. It's not about pushing some kind of ideology. It's about being practical.
Right. And you know what else is interesting about this?
What's that?
Harm reduction isn't limited to just substance use.
That's right.
We touched on this earlier, but I'd love to hear more about that.
Yeah, for sure.
What are some other areas where harm reduction is making a difference?
Well, take sex education, for example.
Yeah, okay.
The whole abstinence-only approach,
Right.
it just hasn't been very effective at preventing unintended pregnancies
Yeah.
or sexually transmitted infections.
Which makes sense.
Right. People are going to do what they're going to do.
Exactly.
So harm reduction in this context would be about providing comprehensive sex ed.
Okay.
That includes information about contraception,
Right.
safer sex practices, and access to sexual health services.
So it's about empowering people to make informed choices about their sexual health.
Yes, it's about promoting healthy behaviors and reducing harm,
Right.
even if complete abstinence isn't the goal.
Because let's face it, that's not always realistic.
Exactly. It's the same principle, just applied in a different way.
It's fascinating to see how that framework can be adapted to all these different situations.
Yeah, it really is. And it's more common than you might think.
Oh, really?
Yeah.
Give me some more examples.
Okay, well, think about occupational safety regulations,
Like what?
like requiring construction workers to wear hard hats
Okay. Yeah.
or safety harnesses.
Right.
Those aren't meant to prevent every single accident from happening,
Right.
but they can drastically reduce the severity of an injury.
That's a really good point. It's about minimizing the risk, whatever you're doing.
Exactly. Or even something as simple as offering free sunscreen at a public pool or beach.
Right.
That's a harm reduction strategy.
To prevent skin cancer.
Right.
You know, I've never thought of it that way, but you're totally right.
It's everywhere.
It's so ingrained in our everyday lives that we don't even realize it's harm reduction at play.
Exactly.
So we've talked a lot about the what of harm reduction.
Right.
But I'm also curious about the how.
Okay.
What are some of the challenges in actually implementing these kinds of programs?
That's a big question.
Yeah.
I think one of the biggest hurdles is the stigma
Right.
that still surrounds substance use, and other behaviors that harm reduction seeks to address.
It's that judgment that we were talking about earlier.
Exactly.
Yeah.
And that stigma can make it really difficult to get funding for these programs.
Yeah, because if people don't see the value in them,
Right.
they're not going to want their tax dollars going towards them.
Exactly. And you often run into community resistance too.
Right, because people might not want a safe consumption site in their neighborhood.
Exactly. It's about changing hearts and minds, which takes time.
It's that perspective shift again.
Yeah.
So stigma is a big one. What else?
Another big challenge is making sure that harm reduction services are actually accessible to everyone who needs them.
Right. So it's not just enough to have the programs. You have to make sure people can actually use them.
Exactly. And that means addressing things like racial disparities,
Mm-hmm.
socioeconomic factors, geographic location.
Right. Because what if the only safe consumption site is in a wealthy neighborhood?
Right.
That's not really helping the people who might need it the most.
Exactly. Or what if it's only open during the day,
Yeah.
but someone who needs it works the night shift?
It's about meeting people where they're at. And that includes literally where they are and when they need help.
Exactly. And it's not just about creating the programs, it's about making sure that they're culturally sensitive
Okay.
and tailored to the specific needs of the community.
That makes a lot of sense.
Yeah.
You know, this is making me think about something else we discussed earlier.
What's that?
The importance of research and data.
Yes. So important.
Because we need that to show whether these strategies are actually working.
We can't just assume.
Exactly. So why is ongoing research so crucial?
It's crucial for a few reasons. One, it helps us understand what works and what doesn't.
Okay.
We need data to back up these approaches.
Because that's how we can convince policymakers to fund these programs.
And it's how we can show the public that this isn't some kind of crazy idea.
Right.
It's based on evidence.
It's about proving that it works.
Exactly. And research can also help us identify any unintended consequences.
Oh, interesting. Like what?
Well, for instance, we might find that a particular program has a positive impact on one group of people,
Okay.
but it unintentionally disadvantages another.
Oh, I see. So it's about constantly evaluating and adjusting.
Exactly. It's about learning and adapting.
And making sure that these programs are truly serving the needs of the communities.
Yes. And as we get more data, we can develop even more effective and targeted interventions.
So it's about innovation, too.
Absolutely. We
Yeah.
need to be creative and responsive.
This has been a really insightful dive into the world of harm reduction.
It's a fascinating topic.
It really is. And as we start to wrap up our conversation today,
Okay.
is there a specific example or story from the source material that really stood out to you? Something that really illustrates the power of this approach. You know, thinking back on everything we've discussed,
Yeah.
one story from the source material really stuck with me.
Oh, I think I know which one you mean.
It was about that woman who was using a safer consumption site, right?
Yes. The one who'd been struggling for years in and out of homelessness.
Right. And she actually overdosed at the site.
Which sounds scary, but that's exactly why those supervised places exist.
Right. And they were able to revive her with naloxone.
Mm-hmm.
And because of that experience, she decided to enter treatment.
It's amazing, right? It literally gave her a second chance.
It did. A chance she might not have had otherwise.
Yeah.
It's like that story, for me, that's harm reduction in action. It's not about judging. It's about giving people the opportunity to make different choices.
Exactly. When they're ready.
Exactly. Meeting people where they're at with compassion, without judgment. Powerful stuff. So as we wrap up our deep dive on harm reduction, what's the one thing you hope our listeners take away from this?
You know, I think it's crucial to remember that everyone's journey is different. Harm reduction is about offering support without judgment, reducing risks, and empowering individuals to make healthier choices for themselves, one step at a time. It's about recognizing that even small changes can make a big difference, and ultimately, that's how we create a healthier and more compassionate world for everyone.
Beautifully said. This has been a truly eye-opening conversation. I hope our listeners feel inspired to learn more, challenge their own assumptions about addiction and risky behavior, and approach these issues with a bit more empathy and understanding. Until next time, keep exploring, keep asking questions, and keep an open mind.